Hello, good morning. I'm Zoe McMillen, one of the physicians here at Lifescape Premier. I hope everybody's doing well and enjoying the slightly cooler weather that we're having, and I don't know, I feel reinvigorated that we can go and do things again like hiking and all these fun outdoor activities. Today I'm going to be talking about both the long-term and short-term effects of alcohol and how it affects our body. The other thing that I was asked to just comment on before I do that is a little bit about COVID-19, about isolation versus quarantining. The main difference is we quarantine when we've been exposed to somebody who has COVID. That's the 14-day quarantine, because technically we have a 2 to 14-day period in which we may become symptomatic with COVID ourselves. Now, isolating is when you've got COVID. That's when you isolate yourself from everybody else. And that's usually a 10-day, can be 14 or longer, depending on if you have immunosuppression, you may shed virus for longer. Or if you're on medication like steroids, that will make you shed the virus longer. So that's just the main difference there. We will be taking some questions as well towards the end here. So if you want to submit some, Dana is joining me to help me with that. So I appreciate that. All right, jumping into the topic today. So humans have long turned to alcohol for relaxation and anxiety reducing effects. As such, it's not surprising that during this COVID pandemic, alcohol consumption has increased. I looked up some stats, and alcohol sales in stores were up 54% in late March compared to that time last year. And a poll done of 2,200 US adults done in early April showed 16% said they were drinking more than usual. So while a quarantini may sound like a good way to relax during a very stressful time, there are some short and long-term effects that are important to know about. And it's important to also mention that alcohol can impair the immune system, which of course is not ideal during a pandemic. If you really think about it, alcohol is one of the only really legalized recreational drugs. And as I said, it's the main reason people drink is because of socialization, relaxation, and to celebrate happy events. For the purposes of this talk, I'm going to tell you what is considered to be a standard size drink. It is 12 ounces of beer or 5 ounces of wine. So if you do drink beer or wine, measure how much you usually get and see, are you drinking a standard drink, or maybe is it 1.5 times the standard drink. So what is considered to be moderate drinking or a relatively low risk for alcohol problems? For women, this is less than 1 drink per day and no more than 3 drinks on a single day, no more than 7 drinks in a week. So it's a lot less than you're probably used to thinking or hearing. For men, it's a little higher, and I'll kind of get into the reasons for that later. It's less than 2 drinks per day, or no more than 4 drinks on any single day, and no more than 14 drinks in a week. Now, often with medications and that we prescribe, we have to decrease the dose as well as we get older. Kind of similar for alcohol. Anybody over age 65, no more than 4 drinks on any single day, less than 2 drinks on a day is considered moderate, and no more than 7 drinks a week. So if you are drinking more than this, you're at higher risk for some alcohol problems and would be considered a heavy drinker. It is important to also mention that certain medications, when combined with alcohol, can be dangerous or even deadly. That's why your physician, if they ever prescribe you a sleeping medication or a sedative, such as benzodiazepines, those categories of medications, we warn you don't drink with alcohol because it can have a synergistic effect and potentially be life-threatening. Now, there are some people who avoid alcohol completely because they feel unwell straight after drinking it. So some people have sensitivities or allergies to alcohol, or maybe another ingredient in the drink. Something that that is not often thought of, if you were tolerant of alcohol and then suddenly you develop an intolerance, you really need to see a physician, or if you know somebody who had that, get them to see a physician. It could be a sign of Hodgkin lymphoma, which is a cancer. So a sudden intolerance when you used to tolerate it fine would be something that needs to be worked up. All right, jumping into what are the short-term effects of alcohol consumption. I guess the reason that we like it is it's relaxing, and that's because it's a central nervous system depressant. So, results in decreased anxiety and decrease in motor skills. So, a little loss of coordination. Also increases your heart rate and your blood pressure and lowers your inhibitions. After having a drink, you may wonder, like, what happens to it? Where does it go? 20% is actually absorbed into the body by the stomach, and then 80% is absorbed through the small intestine. Maybe you've smelt alcohol from a person where you can smell it on their breath or their skin, and that's real. About 5% of alcohol leaves through the lungs, kidneys, and the skin. But of course, the liver is the main machine that removes the rest. Most people who've consumed alcohol have experienced a hangover, so you may wonder, well, what is actually happening to me in a hangover? And a key point here is to remember that alcohol is actually like a poison. So the liver is trying to work to break it down and get rid of it. And the liver is limited. It can only oxidize about 1 drink an hour. So many of the symptoms that come with a hangover are actually caused by dehydration, but also some chemicals in the drink can cause a reaction in the blood vessels and brain that make your symptoms worse. And symptoms are everything from headaches, diarrhea, nausea, fatigue, a racing heart, dry mouth and eyes, difficulty concentrating, or restlessness. Now remember, since the liver can only process the equivalent of 1 drink at a time, the body can be pretty saturated with alcohol that's not left it yet if you had imbibed quite a bit. It can take 2 to 3 hours for the body to metabolize alcohol from 1 to 2 drinks at that point, and up to 24 hours to process the alcohol from 8 to 10 drinks. Hangovers can also last up to 24 hours, so you can feel crummy for quite a long time. And as physicians, we advise don't drink within 48 hours of a heavy drinking session, so that you allow your body to recover and your liver to work on detoxifying all the effects of the alcohol. So we say no hair of the dog. We don't think that's going to help you or work. All right, now I want to move into some of the long-term effects of alcohol. It contributes to over 200 diseases and injury-related conditions, including dependence and addiction, liver cirrhosis, cancers, and unintentional injuries from motor vehicle accidents, falls, burns, assaults, and drowning. Around 88,000 people in the United States die from alcohol-related causes every year. So sadly, this actually makes it the 3rd leading preventable cause of death, and the key there is preventable. Long-term alcohol misuse is also associated with many health problems. Studies have shown initially that blood pressure can decrease a few hours after having alcohol, but then a little later, be it 20 hours after, it increases, and it is a significant increase. So your doctor often, if you have high blood pressure, says cut down on drinking. That may help, and that's one of the reasons why. Also, drinking too much can also lead to depression, liver disease, pancreatitis, cardiomyopathy, that's where the heart muscle's not working as well and contracting poorly, cardiovascular problems, so these are things like your vessels are not squeezing the blood around as well, things like that. Neuropathy, that's where maybe you lose sensation or you have tingling or pain in your feet or your hands. That can be from alcohol. Stomach ulcers, it can increase cancer risk, which I'm going to talk about. As we said, decreases the immune system, can cause osteoporosis or lead to and brain and nerve damage, as well as multiple vitamin deficiencies. Because remember, you're using all those vitamins, which are cofactors and coenzymes, to help get rid of that alcohol. So I'm sorry, women, but it has more of a health effect on us as women than men. Research shows that women who drink more alcohol than is recommended on a regular basis tend to develop liver disease, that heart muscle not working as well, and nerve damage after fewer years than men who do the same. So we just don't handle it as well. And I'll talk about that a little bit later. Having even moderate alcohol, so maybe a glass of wine, half to 1 hour before bed will disrupt your sleep architecture. Once the alcohol has then been metabolized by your body, it can cause disruptions in staying asleep, which often, you can maybe fall asleep easily after having the wine, but then you wake up early, and that's pretty common. Similarly to opioids, if a person consumes a large amount of alcohol regularly, their tolerance can increase. So the body is requiring more and more to get that same effect. So if you used it for relaxation, and one glass used to make you feel very, very relaxed, over time you're going to say that one glass doesn't make you relaxed and you need two. Hence, you can start increasing without even really being aware of it or not really realizing it as much. Of course, as the body adapts to the presence of any drug, dependency and addiction can result. So if suddenly stop drinking alcohol and you used to drink quite frequently and regularly in a heavy enough amount, you may experience some withdrawal symptoms. So it is important to note that alcohol addiction is a disease, and it's characterized by a strong craving for alcohol and continued use despite a negative impact on health, interpersonal relationships, and ability to work. So if you find, if that happens to be you, and you're still drinking even though maybe it caused relationship problems, or you missed the meetings at work in the morning because you'd gone up late or something, think about, do you actually have addiction, which is a disease? And we as doctors want you to come to us and we can help. Signs of withdrawal can occur between 40 to 72 hours after the last drink, or even if you reduce the intake considerably. That usually peaks at 48 hours and then may last up to 5 days. Those symptoms can be mild tremors, difficulty sleeping, anxiety, a depressed mood. And of course, there are very severe ends of the spectrum, which I won't get into here right now. Something that I learned more about while researching this topic is that alcohol is pretty strongly associated with an increased risk for several types of cancer, and the heavier the use, so it seems to be dose dependent as well, the higher your risk. The highest risk is for upper airway and digestive cancers, so think of esophagus, mouth, tongue, larynx, think of esophagus, stomach, all those areas. You also have a slightly lower elevation in risk for breast and colon cancer, but definitely it has been associated with increased risk for those. So given that, the 2020 guidelines from the American Cancer Society advise complete avoidance of alcohol for cancer prevention due to that increased cancer risk, which was evident even with the consumption of less than 1 drink per day. So I emphasize that, less than 1 drink per day, you can see an increased risk of cancer. There's consistent evidence that breast cancer risk is higher for women consuming less than 1 drink a day compared to people who don't drink any alcohol. There appears to be a significant dose-response relationship. So as I said, the more you drink, maybe the higher the risk, with intakes as low as 3 to 6 drinks per week. Interestingly, one maybe positive that I found about drinking alcohol is it's been associated with a decreased risk of diabetes. And you may say, why? It's sugar and that. So I looked into that a little more. And the study had shown that compared with no alcohol consumption, 2 drinks for 8 weeks lowered insulin levels while leaving glucose levels unchanged, and thus improving your insulin sensitivity. I'm not saying that we should all do that for diabetes prevention. There are much safer and better ways to prevent diabetes, but that was maybe the only plus that I really found on the pro of drinking. So you may want to know, well, what is a safe dose of alcohol? And my response will be, that's a tricky question. A safe dose is likely a lot lower in women than in men. Reasons for this include women are a little smaller, lower body size, percentage of the body weight composed of water, and the activity of an enzyme called alcohol dehydrogenase, just to have less of it in women. It results in a heavier alcohol exposure for a given level of drinking. So men can have the same as a woman, but a woman just doesn't have as much of the enzyme, different effects. So probably no alcohol is the answer, but if that's not an option for you, then lower consumption is better. The United States guidelines recommend up to 1 drink per day for women and up to 2 drinks per day for men. All right, so we did get 2 questions here so far that I'm gonna answer, and one is, why do some people of Asian ancestry flush more with alcohol? And this is called alcohol flush reaction. About 80% of Asians can experience a form of this. The reaction is the result of accumulation of acetaldehyde, which is by a byproduct of alcohol, and it's caused by an enzyme deficiency. Here's another question. What is the difference between alcohol intolerance and alcohol allergy? Alcohol intolerance is genetic. It's a metabolic disorder of the digestive system, and your body is not processing the alcohol the way it should. Alcohol allergy is more an immune system response, where your immune system is overreacting to an ingredient in the alcohol. So you may be allergic to one of the substances. It can be a chemical, a grain, because most alcohols are made from a grain, or a preservative, such as sulfite. Symptoms between the two can differ. Both of them can cause nausea, but the hallmark symptom of alcohol intolerance is flushing of the skin of the chest, neck, and face. And alcohol allergy can include rashes, itchiness, swelling, and severe stomach cramps. All right, let me see, are there any other questions right now, Dana?
There was, yes.
Okay.
I'm sorry.
No worries.
Can you comment on the calorie content of and weight gain associated with alcohol use?
Yes, it's sort of like soda in that it's empty calories. So, we often say, for children, don't let them drink juice. That's going to be empty calories. They're not going to want to eat the good nutritious food. They're going to fill up on the juice. Sort of the same for adults. You're getting a lot of calories. So if you actually look at calories, and I don't know it offhand, but it's pretty high. If you look at what 5 ounces of wine is calorie-wise, I think it's over 100. And you're also metabolizing it differently. If you're having it late at night, you may be interfering with that time where normally you'd be fasting. So that's another component. And Dana actually is probably better at answering this question than I am. So I don't know if Dana wants to comment. No. Okay. Any other ones?
No, that's it.
Okay. All right. Well, thank you for joining us today, and I hope you learned something from this. As I said, talk to us if you have any questions. We're always here for you. Thank you so much. I hope you all have a good weekend. Bye-bye.